Hi everyone, my name is Tracy Aikett and I am a child life specialist who is a part of the child life team here at McMaster Children's Hospital. And a big part of the child life role is helping families cope with serious life events. As we embark on vaccinating children over 12, it's really important that we keep in mind that children, some children in particular, need a little extra love and support through this process. With the pandemic, everyone's been stressed. Parents might be a little more anxious as they show up to vaccine centers. Children might be a little more tense. And so we just wanted to offer a few tips to help you feel very prepared in meeting families. And then a few extra tips about dealing with children who might not be coping well at all. I think the biggest tip that I can give anyone in the work that I have done is no surprises. That's what kids, youth, teens, all of them have said. Trust is so important, and it's important that that begins and is existent with every medical experience. So letting them know what will take place is really helpful, and in having that conversation, understanding what parts of the vaccine might be challenging for them. I feel confident, quite honestly, that the vast majority of patients or youth that you meet through this process are not going to have any challenges. They are going to be excited about being able to finally get back to in-school classes, spending more time with their friends. So this, for them, will be one step closer to that goal. On the other hand, we have youth who have always potentially been concerned about having any medical experience. So they could have cognitive challenges that impede their ability to understand what's happening to them. They could have mental health issues. Anxiety is quite common, and for everyone has been more prevalent with this pandemic. So at the beginning, I'm going to talk a little bit about how we treat all youth, and then lastly, I'll touch upon how we might address special things that show up in children and youth, and just some tips that you might be able to incorporate in your practice. When we think about meeting with patients and families for their vaccine, I think the very first thing I would suggest is, as they approach you or where you're sitting to provide the vaccine, welcoming smile goes a long way. Even though they can't see it behind the masks, people can tell by your eyes. Start engaging them in conversation. Hi, my name is Tracy. I'm the nurse who's going to be helping you and your family today. Do you mind having a seat? I know that it's really important to everyone that they not be surprised by what's taking place. So I'm going to tell you a little bit about what I'm going to do today so that you understand the process. And if you have any questions, you can let me know. I'll start by having you and/or your parents look at this information and provide me with some details and confirm some medical information for you, your name and health card information potentially. And then I might ask you about your birth date and have you confirm that. And then when it actually comes time to do the vaccine, it's very quick. So we'll start by cleaning the skin. So what I need you to think about doing is which arm would be helpful to have the vaccine, your left or your right. I typically would recommend that whatever hand you write with, we'll use your other hand, so your non-dominant arm. And then what I'll have you do is expose that skin. So hopefully the youth will arrive in something that will be very easy to expose that part of their body. If they don't, then obviously you might need to make some concessions in your area as to how you'll end up doing that. I would then explain, after we've finished exposing the skin, it's important that the area is cleaned. I have a small alcohol wipe that I use to do that. And then we're ready to go ahead and give the needle, use the needle. At this point, I would often say to youth, would you like that we count to 3 when we do this? Would you prefer that you look away or that you watch? It's completely up to you. You can just let us know what you would prefer, and then I'm happy to work with you and your family. Other tips that I tell people sometimes is to consider whether or not they want to take a deep breath. So this is the time where you would talk about any coping strategies related to pain management or just distraction. Some youth, as I said, who are really excited, they're potentially going to ask you if it's okay to actually take a selfie while you're doing the vaccine, in pride that they're getting it done and to share with their friends. Other people might be a little concerned about any pain that they might feel during the immunization, and so things like ice, holding ice at the site for a minute or so before can be helpful. Some places might have access to freezing sprays or numbing creams. Those can be really helpful. So just think about what resources you have available at your site so that if a youth raises those as concerns, you have the ability to actually help mitigate some of those things. The next step, you provide the immunization, put the Band-Aid on, and then just simply explain that they'll wait in another area for the required 15 to 30 minutes recovery time. I think for the most part, most youth will be great, and that's the way it will go. What I do want to talk about, however, are those kids that do present with some fears, genuine fears. And even though we have masks on, you can see subtleties in their body language, resistance to come into the room, resistance to sit in the chair, maybe pushing the parent to go first or having other siblings go first. There are clear signs. Another clear sign could actually be someone who doesn't say anything at all and is quite withdrawn, with the exception of their eyes that tend to be watching every single move that you make. So those are some of the cues that you might see to identify that this youth might have some challenges or some concerns with this process. Again, I would explain to them that it's important that we're honest and that there are no surprises. Ask them, how they feel about coming here today. Is there anything that I should know? Is there something that makes this experience better for you? Is there something that didn't go well one time so that I know to potentially not do that? It's really about building that connection and that trust. Once that has happened and they've given you some tips or talked with you about things, it's important to do your best to make those accommodations. If someone was to tell you that they'd rather sit on the floor to have the vaccine done, my hope is that you would be willing to accommodate that. Some youth might want to sit with their parent or guardian or sibling or friend. So again, I think it's important that we are willing to help them have a really positive experience. It's important to highlight that for some youth, seeing the needle itself is actually very triggering. And so in those circumstances, you want to be mindful as you're preparing your supplies and even talking with families that the needle isn't necessarily maybe out in plain sight. You're not holding it up in the air unnecessarily as you're having a conversation. Really sort of keeping it in the background. And again, not with the intention that you would surprise them by giving it to them when they're not expecting it, but purely so that you're not raising their anxiety by seeing it. Some youth like to count to 3, 1, 2, 3, and then the poke. I also found it helpful to tell people to count to 3, and on number 2, have them take a deep breath, and on 3, they blow out, at which point they will receive the injection. So there are a variety of things that work. Stress balls can be great in the opposite hand to the injection site. And some families may even bring their own devices, phones, iPads, to provide that distraction, knowing again that their child can be that way. They often will do everything they can to help make it as smooth as possible. So I think, quite honestly, those are the big takeaways. The one last thing I will say is that there are times where we need to stop. So if in the vaccine process you sense that this child is really not coping well, or this family situation, maybe they're arguing about whether or not the child should have the vaccine, there are times where it's appropriate to pause and to consider having that family rebook and potentially coming back to that location or through their family doctor or public health, go somewhere where they can have more privacy and time to sort of work through some of these issues. Because ultimately, every experience builds on the next experience and the next experience. And so we want children and youth to have a positive experience so that as they become adults and look back, they don't have fears and concerns because it's been good for them, or they've seen that things can be better. So it's really about opening communication and supporting that family. And in closing, I just want to thank you for your time. I would imagine at the beginning of this video, many of you probably thought that you had a fair understanding of what children and youth need. My hope is that maybe you have one takeaway to improve the patient's experience. I also want to thank you for all your time and dedication in helping out with the vaccines. The vast majority of you have been redeployed to do this, and we're incredibly grateful for your time and effort in doing this and supporting families day in and day out. So thank you very much for all you've done.